Have you ever noticed a baby who has very tiny features, like small hands and feet, or who cries a lot and has a hard time feeding? Maybe they grow very slowly compared to other babies. These signs might make doctors think of a rare condition called Cornelia de Lange syndrome, or CDLS. CDLS affects how a baby grows before birth and continues to impact their body and learning as they get older. It's not common, but when kids have many unusual physical traits and developmental delays together, CDLS could be the reason. Think of it like a software glitch in the body's instruction manual. The body starts building itself, but some parts don't turn out quite right. Does that sound familiar if you've seen a child who is very small, has bushy eyebrows that meet in the middle, or has trouble speaking? That could be a clue. So what causes Cornelia de Lange syndrome? Imagine your body is built using a set of instructions stored in DNA, like a recipe book inside each cell. In CDLS, there's a typo in one of the important recipe chapters, usually in genes like NIPBL, SMC1A, or SMC3. These genes help wrap and manage DNA properly during early development. When they don't work well, it's like trying to follow a wrinkled, messy recipe. The dish doesn't turn out right. Most of the time, this typo isn't inherited from parents. It just happens randomly when the baby is forming. It's like rolling dice and getting a rare combination. However, in a few families, a parent might carry the gene change and pass it on. So, while most cases are like random spelling mistakes, some can run in families. Did you know a simple blood test can now check for these DNA typos? Now, what are the signs a baby might have CDLS? Let's play detective. If a newborn has very small size, even at birth, thin eyebrows that meet like a single caterpillar, a small upturned nose and hands that might be missing fingers, or are unusually small, that's a red flag. They may also have trouble sucking or swallowing, making feeding stressful. As they grow, they often develop slowly. Maybe they're not sitting up by 12 months or saying words by age 2. Some children have lots of stomach acid coming up, reflux, repeated ear infections, or even heart issues. Behavior-wise, they might be very clingy, love routines, and get upset when things change, a bit like how some people prefer the same seat every day. Sound familiar? Every child with CDLS is different, but these clues help doctors connect the dots. First, they look closely at the child's face, hands, growth, and development, like putting together puzzle pieces. A geneticist, a doctor who studies genes, might say, those eyebrows, small hands, and slow growth. Let's check for CDLS. Then, they suggest a blood test to read the child's DNA and look for mistakes in the usual CDLS genes. That's the only way to confirm it. But here's the good news. There's no cure, but treatment helps a lot. For example, if a baby can't feed well, a feeding tube might help. Kids get speech, physical, and behavior therapy, like building skills step by step with kind teachers and therapists. Heart problems, a cardiologist can help. Reflux, medicine can calm the stomach. The goal isn't to fix the person, but to support them so they can live their best life. Think of it like giving someone glasses. It doesn't change their eyes, but helps them see better. Can we prevent Cornelia de Lange syndrome? Right now, we can't prevent the random gene changes that cause most cases. It's not because of anything parents did or didn't do during pregnancy. No diet, medicine, or behavior causes it. But if a family already has one child with CDLS, and testing shows it came from a known gene, they can talk to a genetic counselor. That's like having a guide who explains, there's a chance this could happen again. Would you like to test future pregnancies? During pregnancy, tests like amniocentesis or chorionic villus sampling, CVS, can check the baby's DNA. Some parents may choose to prepare early, while others use the info for personal choices. So, while we can't stop CDLS before it starts, knowledge helps families plan and care better. Exciting progress is happening. scientists are learning more about how the CD/LS-related genes work in cells. For example, new drugs are being tested in labs that might smooth out the wrinkled recipe, helping the DNA fold correctly. These aren't ready for people yet, but mice with CD/LS-like changes are showing hope. Also, the CD/LS Foundation supports big research networks where doctors and families share data. This helps find patterns like why some kids talk more or which therapies work best. There's even work on a CD/LS severity score to predict needs early. And telehealth has made therapy easier for families in rural areas. So while we don't have a magic cure, each step brings better support, understanding,